Hi, my name is Jessica Embry. This is my physical assessment video. Can you tell me your name?
Kimberly,
Can you tell me how old you are?
6,
How much do you weigh?
55 pounds.
Okay. So as you can see, she's alert and oriented. She's smiling. She's sitting up straight. Can you stand up for a second? She's 53 inches tall, weighs 55 pounds. It takes her BMI to about 14, which classifies her as underweight, but you can see her nutritional status is accurate and adequate. Go ahead and sit down. She doesn't have any obvious physical deformities. She's got range of motion in her head and her back. Can you turn your head side to side? There you go. Now do this. Okay. Then can you shrug your shoulders? As you see, all that is appropriate. So her skin, her hands and her nails are even pigmentation. They're warm, dry. She has adequate capillary refill. It's less than 2 seconds. She's warm, she's dry. Her skin turgor is appropriate. She's adequately hydrated. She's got no obvious lesions. So I'm going to take a look at her head and her face. First, going to assess her scalp. No dryness. Her hair is adequate. Let's see. Can you smile for me? Look at the camera and smile. Can you frown? Close your eyes. Close them tightly. Lift your eyebrows. Show your teeth. Can you puff your cheeks out? And then when I push them, she blows out. That tests the cranial nerve 7. Now her eyes. You would use a pen light to assess her corneal light and her reflexes. You'd use an ophthalmoscope. You would darken the room first. It gives you a little bit better visual of her eyes. You would check the red reflex. Her conjunctiva, as you can see, is pinkish red. It's moist. No drainage. Her sclera is white. Her corneas are a bluish green color. And her pupils are appropriate to the light setting. Now her ears, turn your head to the side. They've got no visual drainage that you can see. You'd use the otoscope and inspect cranial nerve 8. You would inspect the canal, the tympanic membrane. You check it for color, position, any integrity marks. Maybe they've had tubes, which she has had. So you'd be able to see that. You'd see if there's any lesions, any scarring, anything like that inside the ear. And then we would do the whisper test to assess her hearing. With the whisper test, you would step about 2 feet back from the patient, and you would have them cover one ear while you say a word. They would repeat it. You'd cover the other ear, and they would repeat it. So cover one ear for me, and I'm going to whisper a word, and then you tell me what I said, okay?
Dog.
Okay, cover the other ear.
Cat.
Okay, dog and cat. She got both of them. Now with the nose, you could use a speculum or like a pen light. You would inspect her nares to make sure they're patent, make sure there's nothing obstructing them, especially in children and younger children. You inspect the patency, inspect, like I said, her foreign bodies, check the mucosa. It's pink, it's moist. Septum is even. And then we move on to her mouth and her throat. You could use a pen light too to inspect the mouth. Open your mouth for me. You check her mucosa, her gums. They're pinkish red. They're moist. Good sign. You check her tongue. Make sure her uvula and her palate is in midline. You would use a tongue blade, last resort in children. You could use it to check the gag reflex. You would press on like the posterior walls, and then have the patient stick their tongue out, say ah.
Ah.
You use the pen light to look, and you would make sure that the uvula and the soft palate rise in midline when the patient says ah. You notice when she's been talking, her voice is smooth, it's not strained. And then for the tongue, that is nerve 12. You could test this by having them say light, tight, and dynamite. So say light,
Light.
tight,
Tight.
dynamite.
Dynamite.
So you can tell her lingual speech is clear and distinct. There's no issues with it. And then you inspect the tongue too when she stick your tongue out. When you stick your tongue out, you could use your hand, wear a glove, of course, and inspect the tongue, check for any lesions, any open areas, anything like that. Next, we move on to her neck. So you check for a carotid pulse on both sides. Okay. You check also, you could palpate for any swollen lymph nodes. I don't feel any. You also, at this point, you would look to make sure the trachea is midline, which it is. And you can test the cranial nerve 11 by having her move her head against my resistance. So I'm going to push on your chin, you move your head forward. Okay. And then also for her, I'm going to push on her shoulders and she's going to move them up. Good. She had both of those. Now to check her thyroid, it's normally not palpable in adults. You would stand behind them, you would have her tilt her head slightly forward, and then you would have her take a sip of water and you would palpate as she swallows. Her thyroid should move up as she swallows, and then when she's done, it should go back down into the resting position. Now with her chest and lungs, posterior and lateral, can you kind of turn to your side? We'll just stand up. Okay, come over here. This way. Okay. So you check her thoracic cage. It's symmetrical. She's got no lumps or tenderness when you're feeling. Her spine is straight. You use your stethoscope and listen to the breath sounds. Make sure they're clear. And have the patient take deep breaths in and out. Now, you would test the tactile fremitus by taking your hand and then using the same spots that you use to auscultate, and you have them say like 99 or something that causes the vibration. So say 99.
99.
Do it again.
99.
Do it again.
99.
And do it again.
99.
And again.
99.
I could feel the vibration each time she did that. Now with anterior, you check respirations. You would watch for a full minute. Tactile fremitus here too. You just go over the chest. Say it again. 99.
99. 99. 99. 99. 99. 99.
You could hear it in all spots again. And you would do this point here. You would hold their rib cage like this and have them take a deep breath in. And you would watch as your thumbs move apart symmetrically. With upper extremities, you can sit down. You would check for range of motion. So can you move your arms out? Move them out. And then move them back in. Okay, moving forward. Move them back out. And then move them in a circle. Move your wrists in a circle. Do the other one. As you can see, she has full range of motion of her upper extremities. You would check for the epitrochlear nodes. This is when you would shake, when you would get in like the shaking hands position, and you'd reach around with your other hand and you would palpate right under the elbow. They're normally not palpable. Okay, then we move on to the heart. Of course, you measure the apical rate. You use your stethoscope and listen. You listen, make sure it's regular, make sure it's strong, even, no murmurs. You would do blood pressures, and you would palpate for any pulsations with your open hand. There usually isn't any. Then we move on to her abdomen. You would look at her umbilicus area, make sure there's no drainage, make sure it's no open areas, nothing like that. You'd make sure her abdomen is symmetrical. Also, you would listen to bowel sounds in each quadrant, make sure they're active, or make sure they're not hyperactive or hypoactive. You'd also listen for any vascular sounds. You would percuss and palpate in her abdomen area. You do light and deep palpitation. There shouldn't be any tenderness. Has that hurt at all? Okay. And then you would check in the inguinal area, you would check for femoral pulses and any nodes in that area. Can you stand up for a second? It'd be easier if they were laying down at this point. But you would check for her femoral pulses on each side. And in that same area, you would palpate for any nodes. Go ahead and sit down. Lower extremities now. You would look and make sure they're both symmetrical. You look at a hair distribution, make sure it's even on both legs. You would check the popliteal pulses. Rest your leg. Okay. Okay. You'd also check the tibialis and the dorsalis pedis pulse at this point. Okay, they're all present, they're all strong, they're all equal. She has no edema, her skin temperature is warm, she's dry. Then you would look at toes. All her toes are equal, they're symmetrical, no deformities, no lesions. Her capillary refill is great, less than 2 seconds. And then while the patient's sitting, you would look at their hips, knees, ankles, and feet again. So you can tell her hips are even, there's no deformities there. Her ankles and her toes we just looked at, they were even. Knees are also no issues there, no deformities, no swelling. And then we'll move on to neurological. You would test like sensation in their face, their arms, their legs, hands, feet. So can you feel that? Okay. Then you do their arms. Can you feel that? Okay. Hands. Hold your hand up. Can you feel that? Okay. Then you do their legs. Can you feel that? Feel that? Okay. And then this is when you could do the position sense too. This is when the patient closes their eyes and you move an extremity like up or down, and they tell you which extremity and what position it's moving. So close your eyes. Tell me what toe I'm moving. On what side of your body? Good. She said the right toe on her, I was moving her right toe up and down. The stereogenesis, this is when you place a familiar object in their hand and they have to identify it with their eyes closed. So go ahead and close your eyes for me. Put your hand out. What is that? Okay, there you go. And also this is, you can open your eyes. You can have them do the finger to nose. So touch your finger to your nose. Okay, do your other hand. Okay. And then heel to shin. So stand up. And then put your heel to your shin like that. Nope, your shin up here. Nope, do it this way. Here, you can't lean on the chair. Okay, then do your other foot. Okay, good, sit down. And then you would also check reflexes at this point, the Achilles, brachioradialis, bicep, tricep, and patellar. With the patellar, you'd have them sit like this. You'd hit right underneath the patella, and they would move the reflexes. With the bicep, you would have them bend their arm like this. Bend your arm. Let it rest. And then you would tap on top of your thumb right here for the reflex. For the tricep, bend your arm right here. And then you would press right here for that tricep reflex. For the brachioradialis, you would test right here. Just tap on that for the brachioradialis. And then with the Achilles, they would have to be laying down for this. You'd position the person with the knees flexed and the hips externally rotated. You'd hold the foot and the dorsiflexion and strike the Achilles tendon directly. And then feel the normal response as the foot plantar flexes against your hand. So that's how you would assess the Achilles. And then the Babinski reflex is in infants. Normally they'll have it from infant up until about 24 months and then it disappears. The musculoskeletal system now, stand up. Okay, can you walk across the room? Okay, walk back my way. Good, turn around. And then you're gonna do heel to toe. So walk in your heel to toe. Good job. Okay, then walk on your tiptoes. Good, stop right here. Then can you walk on your heels? On your heels. There you go. Good job. And then hold onto the chair and then just bend your knee. Good. Do the other one. Good. And then turn around. Can you touch your toes? You can also assess the spine at this point. Good. Stand up. Can you rotate side to side? This is testing the range of motion of the spine. Good. And then bend left to right. Good. And then the Romberg sign is when they stand with their feet together. Stand with their feet together. They close their eyes and they stand still for about 20 seconds. They should be able to hold their position. You stand close though, just in case they do start to sway or fall. So there you go. That's the Romberg test. Sit down. Lastly, you would, depending on if you had male or female, assess their genital areas. You check their perineal and perianal areas. An older patient, you could use a speculum and visually assess like their cervix, uterus. You could also do like a stool specimen to assess for any like occult blood. And that wraps up the physical assessment. So thank you.